Welcome to Metro Detroit Birth Stories, where we celebrate the power, wisdom, and beauty of birth one story at a time. I'm your host, Exie Bueller, a birth and postpartum doula, childbirth educator, and maternal mental and emotional wellness coach. My passion for supporting birthing families began 20 years ago and has only grown since then. In this space, you will hear real birth stories from Metro Detroit and beyond, along with insights from my work that might resonate with your own journey, because every birth story matters and every journey deserves to be heard. Please note that this podcast is intended for entertainment and informational purposes only. The stories shared are from the perspective of the person sharing it and do not represent my thoughts, opinions, or views. I am a non-medical professional whose thoughts, opinions, and views are my own, so nothing said should be construed or understood as medical advice. Please discuss all of your concerns or questions with your pregnancy provider. Now let's hear today's story. Before we begin today's episode, I just want to apologize for not having one for July. We ran into some scheduling issues and some big technological issues that caused me to not have an episode ready for you. But today's episode is fantastic. I think you're really going to enjoy it. So get ready to hear Trishna's story. Hi, Trishna. Welcome to Metro Detroit Birth Stories.
Hi, Exie. Thank you so much for having me. It's great to be here.
You're welcome. I understand a little bit about your story. Just as kind of a preview, it starts with a plan for a hospital birth that changes. This was your first and only birth experience, correct?
Yes, that's correct.
All right. So before we hear your story, why don't you introduce yourself to our listeners and viewers and maybe share a little bit about you?
Yeah, absolutely. So my name is Trishna Patel-Grigowski. I'm 34 years old and I've lived in Michigan my entire life. I live with my husband, Tom. I have our almost 17-month-old baby girl, Annika, and our dog, Mac. My husband and I actually met in pharmacy school at Wayne State University. And so I have a background in pharmacy. I worked in pharmacy for about 7 years before having Annika and decided to take a step back after she was born to stay at home and raise her. And on the side, I do teach yoga. I teach prenatal and hatha yoga classes.
Fascinating. Did you become a yoga expert or a yoga instructor before you were pregnant?
That's a great question. Yes. It's interesting because I feel like my career in pharmacy actually led me to get having birth at home, and I can connect those dots for you. So I really chose the career of pharmacy because it was a field that, as a child of immigrant parents, it was one that provided financial security and stability. And so we were really encouraged to go down three paths, mainly for career in healthcare or law or engineering. And I chose pharmacy. Pharmacy is something that runs in my family, and it's a career where I felt like I was going to be able to help people. And pharmacy school is really difficult and stressful. And so during my time in school, I turned to my practice of yoga, and more so after I graduated and I began to work a really stressful job. I found myself turning more and more towards this path of yoga, having sort of an identity crisis of spending so much of my life studying and working hard towards this career that my parents wanted me to have. They worked so hard for me to get there, and that ideally should give me everything I needed. And yet I was so unhappy. I was so miserable. And I was at this sort of crossroads of like, what do I do now? And I dove deeper into studying yoga and decided to pursue a teacher training. And then after that teacher training, I gravitated more towards a holistic approach to life in general that felt more aligned with just I think where I was at. And I think a lot of the internal conflict came from this having a really science heavy background, but not always feeling like I was in tune with that, and really appreciating this holistic approach to living. And then we decided to start having a family. And so
Mm.
that's where my curiosity peaked for doing a prenatal yoga teacher training. I thought, if we're going to go down this road, what tools could I learn to stay as connected to myself as possible throughout this journey? And during this prenatal teacher training with Elise Bowerman, who you also had on your podcast, we one of the assignments was watching a documentary called The Business of Being Born. And this documentary was one that was so eye-opening for both my husband and I. We watched it together, and I feel like it really showed us how broken the birthing medical system is here in the United States. And it showed us a lot of how people birth in other countries or approach pregnancy and birth and postpartum. And it showed us what birth could look like,
Mhm.
which was, I think, certain parts of that were things that were never even on our radar, such as giving a home birth or having a midwife. And so that was a really eye-opening documentary. Yeah.
Yeah, I remember because it's an older documentary. Um,
Yeah.
I remember when it first came out, and funny enough, I was just starting my doula career. My very first client was a very holistically minded person, and she is the one who introduced that documentary to me. And there happened to be a public viewing of it in the Farmington Civic Theater. And so we
Okay.
went together, and they had a panel of, there was an OB and a couple of midwives. And it was very fascinating to, at the very beginning of my doula career, to see this video and to hear this panel talking about different parts of that video, because it does demonstrate a lot that needs to be, that at the time was pretty broken in the healthcare system.
Mhm.
Some of it has been addressed looking back over the years, but
Mhm.
still we have issues. Obviously, your baby's only, what, 19 months old, you said? And
Yeah,
then,
17 months. Yeah.
yeah. And then also some positive things that exist in our healthcare system for people who do access it, need it, want it, those kinds of things. I encourage everybody to watch that video, even though it's a little bit older, because like you said, there's so
Mhm.
much that you can still learn from it.
Absolutely. And I think my takeaway from it was it just, like I said, it brought things to our attention that weren't even on our radar had we not watched it. And I think biggest lesson I learned from her whole experience was just to keep an open mind. And it's not that you necessarily have to make different decisions than what you feel comfortable with, but it's just gathering as much information as possible and staying curious to
Yeah.
the possibilities of what is out there, and gathering information to just be sure that what decisions you're making feel aligned with you. I think it's really easy to stay with what feels comfortable and secure for you. Anyone that's in our circle of family or friends, we didn't know anyone who had given birth at home or that had even had a midwife or a doula present at their birth. I think it was just a handful of people that we knew that might have had a doula for support. So it is really scary to navigate outside of that. And it's different. There's maybe a little bit of fear and anxiety, a lot of emotions that can come up for you when you make a different decision. But again, that documentary and then just staying curious just really helped guide us in the direction that felt right for our family.
Yeah. Yeah. So
Yeah.
clarify for me again the time period that you watched this movie. That was while you were training for prenatal
That
yoga, but
was
as an instructor, but before you got pregnant.
Yes, before I got
Okay.
pregnant. Yeah.
Okay.
So And I really credit that entire training, but definitely that documentary for, again, just I think my mind had already started turning in the direction of having a more holistic approach to life in general and also pregnancy. But then that documentary really opened up my eyes to push me to look into, setting that support up for us here. I didn't
Mhm.
know those kind of options were available right here in our community. And, Metro Detroit has a huge birthing community that's outside of, a traditional system. And even within a system, you can still, find doulas or midwives or, people to support your birth, and what your vision is for yourself. So I think it's just knowing that you have so many options was really helpful for us.
Yeah, absolutely. It's one of the reasons why I wanted to make this podcast the way that I have with birth stories, because we need to hear stories. That's how we learn what's possible. And what kind of stories up until that point were you surrounded by? Because I think that that often is what sets the groundwork for how someone approaches their pregnancy or birth, whether that's, you know, a good or not so good.
Mhm. Yeah, I think most of the stories that I had been around that were shared with me were experiences of, I think, overall ones where there wasn't much agency
Mm.
for the birth giver, for the mother, right? There was a lot of sometimes the way that things were shared with me were that they didn't, it's like there wasn't an alternative option for them, but other than what they were told to do and that they were told was happening to them, or there was no also questioning of some of these decisions that they were left to make. And so a lot of the stories, I guess, in a more general and broad term, was is just there's less choices offered, less discussion, less back and forth of this is what's going on. These are all of the options.
Mhm.
And it was more just this is what's going on. This is what you have to do. This is what the plan is now. This is what's safest for the baby. And there was so much less challenging of that. And that, or this doesn't feel right. Let me go somewhere else or
Mhm.
seek a different opinion. And that was the overarching theme, I think, of the stories I had heard.
Yeah. And to your point, when you started talking about the documentary, we don't know what we don't know. So if we don't
Absolutely.
have that exposure to options, then the only thing we're familiar with is what people have told us, which in your case
Exactly.
was a very traditional, basic hospital medicalized birth care.
Mhm. Yeah, and it's not to say that everyone that has had that experience that I know came out of that having a negative experience,
Mhm.
but again, I think it's just I think so many I think this information, that there are so many different options and ways that you can be supported throughout your experience, should be more common knowledge and should be more openly shared, openly accessible and available. A lot of these things aren't even covered by insurance, and so, there's so many components to that. But I think the biggest goal I had when we found out I got pregnant was that I knew I'm a type of person who would need support throughout this journey,
Mhm.
from people outside of my own circle, if that makes sense. Just people that were solely focused on me and baby and could give us more of an objective, perspective or, you know, objective discussions versus parts of their experiences being pulled in and, and kind of swaying what direction you want to go in or any fear for your own, safety or for you and baby. I didn't want any of that. I think I wanted support that was open to what I wanted, open to discussion, open to me challenging and asking questions about certain decisions that we were left to make with. And so, yeah, that is possible.
Yeah. And yet you started your
Yeah,
pregnancy in a very traditional Western fashion.
I
So
did. Yeah.
let's
Yeah.
hear it. How did you
Yeah.
Why did you
I
start that way with all of this
yeah.
exposure that you had? And then how did that change and when and why? All the things. Tell us all the things, Trishna, please.
Yeah, let's get into it. Oh, that's a great question. So I started off so pre-pregnancy, you know, doing annual visits with your gynecologist. I had visited a few gynecologists and just had some really negative experiences, unfortunately, with several of them. And so after watching the documentary, I knew that I potentially wanted to work with a midwife, but it was still felt a little scary to be outside of like a medical setting for me. I really wasn't sure about that. I didn't really have home birth on my radar at that point. But I just felt maybe choosing a different provider would be a great place to start. And then I knew I wanted to have a doula by our side throughout this process. So we started off seeing a certified nurse midwife in a health system, and the visit started off going really well. I felt like, it felt like a different experience than I've had with providers in the past, in a way that we were presented with a lot of information and choices, and we were left to make what decision felt right for us and not weren't really pushed in one direction over the other. And so things were starting off really great until we kept going further along in the pregnancy, and I started to notice there was some more like encouraging us to go in particular directions and a little bit of pressure to make certain decisions. And there was some fear mongering really early on in the pregnancy that felt really unnecessary for me, considering that I was really low risk. And at that point, I started to feel like, I don't know, we're in the second trimester. I thought this was going to be a great plan and provider to be working with. And now I'm not so sure. But I also don't know that I have time to look for a different provider, or that it would be a different experience if I did. So, cut to talking with my doula about all of how I was feeling. And I credit having a home birth to the conversation I had with her, Rachel Sementelli. She asked me some really great questions and left me to with a lot to think about and reflect on personally, of just why I wanted to stay with that provider, why I felt safer within a health system that I also had some mistrust with as well, and just what I envisioned for birth and where I felt the safest.
Mhm.
And ultimately, I realized the answer to where I felt the safest was in my own home.
Yeah,
And so with her support and encouragement and reassurance that it wasn't too late to change the birth plan. I think that was
right.
a big thing for me. Being the first pregnancy, you feel like you're all set, and then all of a sudden you're throwing your whole birth plan out the window. You're deciding to work with an entirely new person.
Yeah,
And I didn't even know who that was at that time. So that was a really big step. But she encouraged me to just be curious and
right.
ask questions. So talk to some certified professional midwives that typically work in birthing centers or at home, and just have conversations with them. Ask them all of your questions, your concerns about home birth, whether or not you'd even be a good candidate for it. You know, whatever it is that was on my mind about birth, she's like, just ask. And so that's where we just started.
Mhm.
It was nice because there was no pressure to commit to anybody. We were still had our midwife in the health system, but then ultimately we decided to talk with Savannah Stone from Magpie Midwifery, and she came over to the house. We had a chat for almost an hour and a half or so, just talking through every question and concern that Tom and I could think of about home births, how they work,
Mhm.
what's the rate of transfer, what could go wrong, what happens if something goes wrong, and all the things. And after that conversation, we were pretty set on doing a home birth.
Yeah.
So
So
yeah.
it sounds like you interviewed or discussed things with more people than just at Savannah, that perhaps you looked into. kind of a middle ground with the birth center?
Yeah, I thought about the birth center, and then I think ultimately I realized that I just felt safer at home. I
Yeah.
felt more comfortable at home,
Mhm.
and I'm somebody who doesn't do well with needles and hospitals and blood, and, I mean, home births do involve blood, but, I don't do well in a medical setting to
Yeah.
begin with, so it was ironic that I thought I felt safer and more comfortable there,
Mm.
and I think it was more so having access to certain things in case of,
Oh, yeah.
right, in these scenarios, but so birthing centers were on the radar, but I think ultimately I felt the most comfortable being at home and, yeah, not and being, yeah, in a setting that I felt the most familiar with,
Mhm.
and that I knew my body would feel the safest in this environment.
Yeah. And I have to credit
Yeah.
you because it sounds like all of the questions you asked were open ended questions where
Yeah.
your potential provider had to give a very clear answer to you instead of just an ambiguous, like, yes, no, sometimes,
Mhm.
which is kind of how
Yeah.
we typically have those conversations with medical personnel. Like, do you, I don't want an episiotomy. When would you do one? Only if necessary. Like, instead
Right.
of saying like, how often do you find yourself needing to do episiotomies?
Mhm.
It's just that
Yeah.
change of phrase can kind of pull out more information that you can use to make the decision that feels best to you. And it sounds like you did a great job with that.
Yeah, I appreciate that. I think it was empowering for me. I'm not one to speak up very quickly, I should say, but I think having the support of our doula and a really open conversations with my husband Tom really empowered me, I think, to be bold and to have that open dialogue and keep pushing for the whys of a lot of what I was told, because I think for me, it was really important to have all of the information available to make the best decision for myself, and I didn't want to, yeah, I think I wanted to make sure that we were aligned with the relationship that we had with our provider was one that felt aligned with the direction we wanted to be heading in.
Mhm.
And so that transparency was also really important for me. So, if I was challenging or asking questions or asking why, it was important for me that that was respected and
Mhm.
that the provider felt really comfortable and transparent sharing what they knew. And if they didn't know, that was important for me to be able to trust in the person that was going to be delivering the baby
Right, right.
and
Yeah.
taking care of me. Yeah.
Yeah, exactly, exactly.
Mm.
So you felt that with Savannah. She
Yes.
what was the word that I'm trying to say? She deserved your trust based on that
Yes.
conversation. And
Oh,
so
Savannah was, yeah. She is confident. She is clearly very experienced and knows exactly what she is doing and very honest and transparent from our first conversation all the way till through to our postpartum visits. I never felt a sense of anything other than she was being honest and transparent and that she was confident in whether she knew the answer to my question or would find out the answer to my question. So I think that's a really big and important quality to have in a care provider.
yeah, absolutely, because care changes from person to person and as time moves on. Way back in the day, they used to x-ray pregnant women. Like, if anybody were to
Yeah.
mention that now, like to take somebody for an x-ray, they would like be appalled. So it's
Yeah.
important, I think, because we can't know everything. And if a provider insinuates that they do have all the answers, I think that's a little bit of a flag to kind of like
Mhm.
explore because that can't
Yeah.
possibly be the case.
Yeah. Yes, I agree. I agree. I think that the quality of being a little humble and just honest is a very important quality to have in a care provider and in building that trust with.
Yeah, yeah. So you hire Savannah on. Was it
Yeah.
a clear switch from your other
Yes.
provider? Okay. Tell us a little bit about how that went, because like you had said
Oh,
earlier,
yeah.
that could be a daunting conversation to have.
Yeah. I wasn't sure how we wanted to approach that initially because I felt, again, I'm not the boldest person naturally, but I I think for me, we had 2 options. So, many people who work with a certified professional midwife outside of a health system might still have a certified nurse midwife within health system that they're kind of following, with along with both providers, and a big reason for that could be that when you choose to work with a certified professional midwife outside of a system, there's a lot that's not covered by insurance, right? So lab work, or all of your care or vaccines, whatever, all these tests that you might need to get done. There's a big chance that you'd have to pay that out of pocket, and so you can choose to work with both and just be open with that certified nurse midwife that you're doing planning a home birth, but you just want to see them up until the end and see if they're open to that. Or you can let them know that you're no longer going to work with them and that you're choosing to do a home birth. For me, I think I s- choosing to do a home birth, although that felt like the right decision for us, it was still a really big and scary decision considering we chose that in our 3rd trimester at the beginning of our 3rd trimester, and I didn't want any extra noise that would get in my head about what decision we had chosen for our family. So, because I had started to feel so out of alignment with my original provider, I think I just felt like we just had different philosophies and a different approach than to birth, and that's okay. But to just be respectful of her time and to also stay on track and focused on where we wanted to go, it was important to have that conversation with her of like, we were going to do a home birth and that we no longer were going to be working with her. And she was very decent about it, very respectful of our decision. I'd let her know that if in a non-emergent event for the home birth that, that hospital would be our backup, or if
Mm.
anything had changed, I would reach out to her to reconnect. But yeah, it was important to just kind of have that conversation for me.
Yeah, yeah. One of the things that you mentioned also was some of the what ifs, right? A lot of people have that as kind of propelling them to make their decisions about providers and birthing locations. Um, but you also mentioned that Savannah, one of the questions you asked was about her transfer plan. So, can you
Mhm.
enlighten us a little bit about what a transfer plan is and what that would have
Yeah.
looked like had you needed it?
Yeah. So transferring from home to a hospital, there are several different scenarios in which that could happen. It could happen because you just choose to. When you have your first baby, usually people that give baby for the first time have a really long labor. And so sometimes what can happen is you're really exhausted and you're just depleted and you feel like it's just you can no longer continue at home, and so it's a choice to say, "Hey, I wanna go to the hospital and get an epidural, and I wanna," whatever the case is, and so that's an option, so it can be like a choice, or in an more emergent situation, maybe baby's heart rate is lower than they want it to be, or there's more bleeding, or whatever the scenarios are. So in those scenarios, then we discussed with Savannah ahead of time what would be the hospital that we would wanna what the hospital would be that we would go to in case of emergency, which would be the closest hospital, and then which hospital we would go to in a case of a non-emergent event. So that would be take a little bit maybe longer to get there, but that would be the hospital of our choice. And then she was very clear that she would be with us the entire way, like in the car. You wouldn't be left alone. You'd be with her all the way up until you literally get exchange hands to a different care provider. And then she's no longer able to practice in that setting. And so that's where she would leave us. But our doula, who we had, would be able to come with us for the rest of that journey, whatever that looked like. And I would know and trust that Savannah would follow up with us to just, again, they think wrap things up and follow through with whatever ended up happening. But at that point, your care is being transferred to a different physician or a provider. So, but yeah, so there was no doubt in my mind that if in case of a transfer, it would just be like she would drop us and leave. They walk you through the entire thing and then make
Mhm.
sure you're fully taken care of before she would have to leave.
Yeah. So it sounds like you made sure all the bases were covered, which I think is really important for people to understand.
Yeah. Yes, absolutely. I think one of the biggest things that Tom and I would do before every appointment or anytime we had like a thought or a question that would come up for either one of us, we would make a note of it and then either ask at a visit or just communicate openly via text or email because I think it was we were pretty late in the game when we made the switch. And so we just wanted to make sure that we had a lot of clarity moving forward, as much clarity as you could have moving forward. Yeah.
Yeah, that's great. And I think it's a wise thing for anybody to do because a lot of times we get into those appointments and we forget what had been on our minds 3 days before. And then we leave and then
Mhm.
it comes back to us and then it's like, "Oh man, but I just left my provider." And especially in a
Right.
traditional system, they're not always, you have your patient portals and things, but they're not always the ones who answer you. Sometimes it's their PA,
Right.
sometimes it's a nurse. And if
Yeah.
you're really trying to build up that relationship, it's kind of nice if you can actually hear it from the provider. So having a little notebook or
Yeah.
something on your phone where you can quickly jot a
Mhm.
question down and it pops in your head for your next visit, I think is a really, really good piece of advice.
Yeah. Yeah. That was one that we, even for postpartum visits, we just kept continuing that little tradition. So, yeah, very, very helpful to do that. And I think also when you do have the conversations in person, it allows for more of a dialogue and more of a back and forth versus just like question and answer and it being, I think you can learn a lot through conversation as well. And so that was really important to try to ask questions and person as much as we could.
Yeah. And so a lot of people think if you have a home birth and you have a midwife, you don't need a doula. But it sounds like your
Mhm,
doula was really an important part of this whole team that you were building. So
mhm.
bring us to how, so you switched, it was a third trimester. Things are
Yeah.
going very well. Savannah's taking care
Mhm,
of all of your needs. How is she
mhm,
handling, since you weren't taking that care together with this certified
mhm.
nurse midwife, how is she handling things like lab work and tests and things like that?
Yeah, so she is coming over to the house for every prenatal visit, and she is measuring me. She's checking, listening for baby's heart rate and heartbeat, I should say, and she is bringing tools to the house to draw blood to send to labs. So we would do that periodically. I did have some trouble with anemia throughout, especially towards the end of the pregnancy. So we really had to work to get my hemoglobin back to a healthier range to be able to give birth at home or
Mhm.
to a range where, especially Savannah, felt confident and comfortable with me giving birth at home too. And so she would come to the house and do all of that and then send out the lab work. And once the results would come to her, she would send them to me immediately and call me. And it
Mhm.
wasn't just here's the labs and everything looked good. She would call me and we would have a conversation. We would go over anything that stuck out to her, any questions that I might have about any of the values, whether they were out of range or not. And then she even offered that if we had wanted to order any ultrasounds, that she would be able to do that
Mhm.
for us and that we would just be able to go to an imaging center and get those taken care of. And so again, even if you choose to work with somebody that does not work within a medical system, they're still able to provide a full quality care.
Yeah. That's great to know. I think it's also
Mhm.
great to see. It sounds like Savannah has a very strong presence in the community with medical providers so that they are aware and they are taking her requests and running these tests respectfully as they would with any other care provider. I think that's really really important to highlight. So um,
Yes.
and so did I'm sorry, your doula's name was
Rachel.
Rachel.
Rachel
Did Rachel
Tremontelli, yeah.
come for every visit that Savannah was there for? Were they working that closely together?
So they both knew of each other. Most of my conversation and connection with Rachel was either over phone or like video call initially. And then as we got closer to the deeper into the third trimester, I should say, I did arrange for everyone to meet that was going to be at the births. That was important for me to just have everyone in one room for even a little bit, just to communicate a little bit about like what the birth plan was, take a look at our home where we would be setting up the tub or the birth tub and all of the things. I didn't want the first time everyone was going to be coming into our home with like when the baby's here. I wanted them to have a little bit a lay of the land. So I arranged with everyone's schedules to have Savannah, and then she was bringing a birthing assistant, which is also another really important thing for me, I should say, when I was looking into midwives. Some of them work alone, but for me, it was really important for me that the midwife would had a birthing assistant because I felt more comfortable, I think, having two people present that knew what they were doing with me and with the baby,
Mhm.
just in case more hands were needed. So I wanted, yeah, I wanted that for sure. So Aushi, our birthing assistant, was going to be here, and then Rachel. So all three of them came. They got to meet Tom and I together, take a look at our home, and then answer any questions that we had, and then talk amongst each other to just, yeah, have a conversation and meet before the birth.
Yeah, I think that's really,
Yeah.
really great that they were all able to do that. And you took the initiative because as
Yeah.
I'm thinking about it, like when I go into hospitals, I always have to reacclimate myself because every hospital is different, and some hospitals even have different layouts depending on the room. So
Mhm.
it does take a moment to like kind of, you know, evaluate where everything is and know how
Mhm.
everything might go.
Yeah.
And and typically there's a nurse that I can ask, I'm a little confused. Where are these? How can I make
Yeah.
sure we have enough of these? But when it's your home, you're the one who knows all those things. And when you're in labor is
Yeah.
not the time you want to be giving those
Yeah.
directions.
Yeah, and I also didn't want Tom to have to worry about any of that either, and so for me, it was helpful to show, like, for example, Rachel, where extra towels are. This is where our fridge and food and water and all these things. If you need a bucket or whatever it is, this is just where it is. Feel free to go looking if you can't find something, but yeah, just letting them know where the basics were
Mhm.
was, yeah, helpful. And I think so even when I was seeing the nurse midwife within the hospital, you're not necessarily going to be having that midwife deliver your baby. So even though I chose to have all of my prenatal visits with the same midwife, you're actually in a hospital setting can't guarantee that that midwife is going to be there when you go into labor. And so for me, it was really, I think I felt personally safer knowing the face that was going to be there when I was giving birth. That was something I needed. And
Mhm.
so another big reason why we switched to a home birth or having professional midwife is because they're the person, they're going to be there,
Right.
so, and I wanted that familiarity.
Yeah. So bring us to the day of what happened.
Yeah.
How did Annika enter the world?
Oh, oh my goodness. So we just, I was 40 weeks and I think 3 days. So I was getting close to, you know, giving birth like any day now, and not much felt like it was changing within my body, but I, was trucking along and then feeling kind of blue that, I'm over being pregnant, everything hurts. I'm so uncomfortable. And my mom had come to stay with us a few weeks before the baby came, just in case, she came early. We didn't know the gender at the time, but just in case baby came early. And she thought, why don't you two go out to dinner and have a little date night? This might be the last date night you'll get. And of course, that's exactly what it was. So it was a beautiful summer. This was in March, but it was like 70 degrees that day. It was beautiful and sunny out. We got all dressed up and we went out to dinner, and we're got some ice cream, of course. And then we're walking back to the car and I heard a little pop noise. And I had done some research on Reddit because the Reddit community always has the best advice and answers, in my opinion.
Mhm.
And the Reddit moms had said that they knew they went into labor, or that their water was that had broken because they heard a little pop sound. And I'm like, that I've never heard that sound before. So I'm looking down and I don't feel anything. And I waddle back to the car and get in the car and go home. And then I get into the house and now I can feel things are wet. I'm like, I think that was my water. So Savannah had given some swabs to check for amniotic fluid.
Mhm.
And so I went in the bathroom, I did the swab, and I came out. We sent her a picture of it and she was like, that's your water breaking.
Mhm.
And so within a half an hour, she shows up at our door. I change into something comfortable. And I should add that after we got home, within 15 minutes, I was down on my hands and knees with my first contraction, because that's how like powerful it was for me.
Mhm.
And then Savannah came. My my parents were both at our home, but my dad stepped out for the birth and my mom stayed there. But she left to give us some privacy. So she was upstairs. And so it was Savannah, Tom, and I. And every like half hour, every 20 minutes to a half hour, I'm back on my hands and knees with these contractions and I can't really think straight. And Savannah's like observing me and she's like, I'm going to stay for an hour and observe you. Why don't you guys just hang out and relax? And
Mhm.
then after an hour, I'm going to go home and let you guys sleep through the night. Because again, most people giving birth for the first time have really long labors.
Mhm.
So we sat down to start a game of Scrabble and I went first. I put the word jug down on the board and and before Tom could even think of his put the next letter down on the board, I was like, I'm done with this game. These contractions were coming on full force. And I looked at Savannah and I said, you cannot leave us overnight. This baby is coming.
Uh-huh.
I'm like, this is I've never felt these sensations before. And I just had this feeling that the baby's gonna be here like tonight.
Yeah.
This baby's coming. So Savannah was like, I think you're right. I think we should start setting up the tub. And so we set up the tub. I got changed and I can, s- I'm starting to get into this zone. They say when you're going through labor, you're just like in a different place. And I got that. At that point, I'm like, okay, I'm half here, half present, and half in a different place. And I can feel Savannah watching me and like taking a peek at her watch, timing contractions. And then the tub is ready. I start laboring in the tub. And somewhere along the way, Rachel shows up and I have no concept of time. I'm again lost in the experience, laboring in the tub. Had planned to give birth in the tub,
Mhm.
but then baby's heart rate started heading a little bit lower. And so Savannah was very clear about what was going on. And, without an ounce of worry in her voice, she just had this like such a confident and tender way of saying, this is what's going on with baby. Why don't we get you out of the tub and let's just try a different position and see if baby likes that better? And just her way of coaching was so gentle and yet confident. And so I was so comfortable surrendering to whatever she wanted me to do in that throughout this entire experience. So I'd full trust in her. And I think the transparency was a really big part of that. And so we labored outside of the tub on the bed for a little bit. Baby's heart rate comes back working good, sounding good. And then start laboring on the bed. And then so Savannah usually calls the birthing assistant when it's getting really close to baby about to come.
Okay.
And so all of a sudden I hear her saying, I'm going to step out and call Aushi. And I'm like, wow, we're really moving along. And so she shows up and I'm like, okay, baby's going to be here very soon. I can feel it. I just don't know how we're going to get there quite yet. So my labor kind of slowed and plateaued a little bit. And to get it to progress, they were, suggesting that Tom and I just spend a little bit of time like cuddling together in bed to get the oxytocin flowing. And maybe that will help like push baby along. And I don't think I said very much throughout this entire time, but without saying it in my words, but rather through my actions, I started like using my breath to help give baby a push and like move labor along. And they turned around and they were like, never mind. The babies, she doesn't seem like she wants to cuddle with her husband right now. And so within a couple of more pushes and then baby was born. And then, like I said, we didn't know the gender of the baby at the time. I think we were just shocked that she had come out and was laying on my chest. And Savannah was like, Dad, if you want to come and see what, you know, who your baby is. And
Right.
so he got to take a peek at baby and then came to whisper in my ear. We had chosen two names, one for a boy and one for a girl. And he whispered in my ear that baby Annika was born. And so that was how I found out she was a girl.
Oh, I have goosebumps.
Yeah,
That
yeah, it
sounds
was
so
a pretty
beautiful.
surreal experience.
Yeah. Yeah. So through this story that you shared, I don't think you mentioned a vaginal exam at all.
Yeah. Yeah, we never had one. I think Savannah was big on that, but and also big on whatever we wanted. But I think our goals were. That's why I think our philosophies were so aligned. Where I didn't want any intervention when it wasn't like really necessary, and so it just never, we never needed to do one.
Yeah. Yeah. Because I think
Yeah, it
people
was.
are conditioned to believe not just
Mhm,
pregnant women or pregnant people, but also
mhm,
providers, nurses and residents and OBs and even some midwives in hospitals are sort of conditioned to believe that we won't know how far along her labor is progressing unless we do a vaginal exam. But it
mhm,
sounds like Savannah's approach is watch the mother, listen to the
mhm.
mother, see how the mother is changing, check the baby's heart rate, all of those things.
Yes. And feel that midwives can feel and tell where the baby is, and they can tell where the head is, where the butt is, where everything they have this way. And so, yeah, we had no exams done, and she could, yeah, and I think she could also kind of tell based on like just watching,
Yeah.
right? There was nothing that was she didn't need to be very hands on, but it was more actually just observing and taking and seeing what was happening and letting it naturally progress.
Mhm.
Yeah.
Yeah. And
So
yet,
no, there's no
at one
exam.
point, she noticed that you needed to move from the water onto the bed.
Yes.
So it
Yes.
sounds like in
Yeah.
her observations, she was able to pick up that a change of position
Mhm.
was necessary for baby.
Yeah. For baby's heart rate. Yeah, because they are listening to baby's heart rate the entire time to make sure that, and I think what that can help them tell where baby is as well.
Mhm.
But that's a big thing that they can monitor is like how baby's heart rate is, and that can tell them a lot about, I think, like changing positions or whatever's needed. Annika came out with a nuchal arm, so her arm was wrapped around her, and then there was a cord wrapped around her arm, and so if she hadn't had her arm and cord wrapped, it's possible that the labor would have been even shorter. So from start to finish, our labor was 5 hours,
Oh,
which
wow.
is considered more categorically like a precipitous birth, where
Mhm.
usually the labor is less than 3 hours from the start to the birth of baby. But yeah, it was about 5 hours.
Wow.
Yeah.
That's
Yeah.
amazing. It sounds like your body did a lot of
Yeah.
work that you weren't even aware
Yeah.
of. And that's another thing too, because it doesn't sound like a lot of, especially first time moms, I notice a lot of them, they're going online, like you said, the Reddit community and all of these other
Mhm.
online sources. And I get a lot of people who are using terms like, how can I make myself get into labor? How can I make labor
Mhm.
start? How can I get like, you know, and they're
Right.
trying all these things, they're eating
Yeah.
all these foods and doing all this, you know, positional changes and exercises. And oftentimes I have to
Yeah.
step in and I have to say, hold on a minute, because your body, labor is a multifactorial process and you can't make yourself go into labor.
You're
You
right.
can do things to support your body to be in the best place for labor once it wants to begin. But all of these exercises and all of these things that people try to do oftentimes just wears them out and increases their stress
Yeah.
level because they feel like almost like they're failing because they can't make it happen.
Yeah.
Did that ever
That is
cross your
such a
mind?
great point. Yeah, that's a great question. So I want I didn't want to I wanted to give birth at home and I also wanted to give an unmedicated birth.
Mhm.
And so that was a really big decision for me. So in order to help my confidence with that, my doula recommended hypnobirthing
Okay.
classes. And we took hypnobirthing classes, my husband and I both, with Janice Weaver Rex. And throughout those 5 weeks, I tell you, she kept just drilling how important it was to remember that giving birth is your body's natural process. And so very little has to be messed with in order to make that happen. And so that was the biggest takeaway that I learned from her classes and that I kept telling myself was to anytime I started to feel doubtful or feel like I needed to do something to change change the pace or the outcome or change whatever was happening, I kept coming back to trusting that my body knows what it's doing right
Mhm.
now. And just because I haven't felt any signs of labor or gone into labor yet, it just means that baby needs more time inside to
Mhm.
cook and he or she is not ready to come out yet. And he or she will come out when they're ready.
Mhm.
And so that was a lot of working with Janice had to do with trusting and surrendering to the body's natural process. And
Mhm.
she really empowered us to feel confident in going down the path that we chose to, again, by just reiterating that we already have all the tools that we need. We just have to slow down enough to trust in them and trust that even when we don't feel like we know what we're doing, our body's designed to has been designed to do this for years. And so, yeah, that was a big thing.
Yeah, thank you for that. And a lot of people, I think you were 40 weeks and 3 days. And a lot of
Mhm.
people who are getting care from within the system, they're told that at 41 weeks they have to be induced. So
Mhm.
with Savannah, was there ever a cutoff point where she informed you that if your pregnancy continued to a certain point, then it might be the best thing to transfer care or look at that as an option?
Yeah, so we had definitely had those conversations. I think for us, there was a cutoff of like 41 and 6 days. So 41 weeks and 6 days. But I will say that Savannah was committed to trying everything and anything possible to do before that had to happen, if because that wasn't our vision. So she was prepared to, again, refer me out to try acupuncture, to work with a different chiropractor, to again try whatever else that we could do in order to like nudge baby along. We never had to do any of those tricks, but I think it was good to have that conversation and just understand that there is this again this cutoff, not to make you nervous or afraid, but just to keep you, I think, to be transparent and keep you informed of like, this is just what it has to be. And so obviously, as we were getting closer and closer to that 41 weeks, I started getting a little bit nervous. But again, I think coming back to trusting that my body knows what it's doing was a big thing for me. It was a big test, but it was a big lesson I learned that it's true.
Yeah, yeah. And I think it's important also to be aware that those complementary therapies like acupuncture and chiropractics, they're not designed to override your system, right? They're designed to support what your system should be gearing up toward, whereas
Yeah.
a lot of the pharmaceutical or medical induction methods kind of override your system.
Right. Yeah.
So I think it's really important for people to understand that, because you still can't make go into labor with chiropractics or acupuncture.
Right.
If your body just, for whatever reason, whether it's a hormonal issue, a structural issue, a baby issue, if labor doesn't begin with those kinds of complementary therapies, then yeah, it's maybe an override is necessary, but it's
Right.
not the, that's
Mhm.
not required
Yeah.
for.
No, yeah, absolutely. I should clarify that I think the biggest thing that those therapies and even other therapies would help with is reducing your body's stress
Mhm.
level, and
Yeah.
I think reminding your body that it's safe to give birth, because when we're in this fight or flight mode and we're stressed and we're feeling anxious, that's that's signaling to your body that it's not safe to give birth, right? To birth, this baby right now in this environment. There's some sort of danger that's out
Mhm.
there, right? And so that's another thing that we learned in Janice's class was, animals when they give birth in nature, when they see a threat or feel a threat, they will stop their labor
Mhm.
until they reach a place where they feel safe enough to continue.
Mhm.
And so we're no different,
Right.
right? So these,
Those
yeah,
stress hormones, I try to teach my clients the stress hormones directly inhibit the hormones
counteract,
necessary for
yeah,
labor. So
exactly.
that's one of those things where if you're getting more and more anxious about this looming date, your stress levels are rising in your body, and then you're also trying all of these things and then going online and trying more things. That's also
Yeah,
contributing to increasing your stress levels. So it's almost, what do they call it, like a self-fulfilling type of thing that ends
yeah,
up happening, and you don't
mhm,
even realize it.
exactly, exactly.
Yeah. So thank you for sharing all of that. Let's get
Yeah.
back to Annika's entrance into the world. So you've got her, she's on your chest. What does a postpartum
Yeah.
home birth, or what did your postpartum home birth
Oh,
immediate immediate happening look
well,
like? I can't even talk. I'm so like
yeah.
I'm in
No,
awe of
you're
you.
okay.
How did that look after she
Um,
comes out? Because you're still pregnant, right? You still have to deliver the placenta
yeah, you
and
still have to exactly, you still have to deliver the placenta. So you have about so Annika's born, and my mom was able to be there to witness her as soon as she came out, which was really special. And then it was time to have some one-on-one time with Annika, and the Savannah and Aushi were really great about, and Rachel great about helping baby start to latch and get that skin to skin contact. And they're cleaning things up. I should also add that I was given, so Savannah and I had this conversation ahead of time because we were both on the same page that we didn't want any intervention unless it was medically necessary. And because of my hemoglobin and my anemia, we had talked about, she said, I would feel really comfortable having IM injections of Pitocin
Mhm.
ready in case I see that you have lost more blood I than is safe for you. And so we had several conversations about it, but she was okay with taking a look at how much blood I had lost and then evaluating in that moment whether or not she needed to give me an IM injection of Pitocin. And I gave her full consent that it would be okay if she felt like it was necessary. Because at that time, that's not when I wanted to have this back and forth, right? And
Right.
so, so she gave me an IM injection of Pitocin. She reminded me that hey, I'm going to go ahead and give this to you
Hmm.
just as a reminder. And that was fine.
And that was a shot.
And that was an IM injection. If it was
Yep.
a shot.
It was a shot in what
And
area of your body?
I believe she gave it in my thigh,
Okay.
if I remember correctly.
Hmm.
And so then we proceed to have some one-on-one time with baby, and I still haven't birthed this placenta. I think you have about 60 minutes to birth the placenta before you need intervention.
Okay.
And which was something we had talked about before. I didn't really think much of it because they said typically it comes out within a couple of pushes or whatever.
Hmm.
But I was so caught up in the bubble of baby that and Savannah, they're starting to clean things up and they're like, so we need to get this placenta out. And with no urgency in their voice, they were suggesting, why don't you try coughing a few times? Why don't I walk you to the bathroom and why don't you try like sitting on the toilet for a
Hmm.
little bit to just help gravity work its way? And I'm just going along with whatever they're saying. I'm not really paying attention. Again, I have no concept of time, no idea how long it's been. And and then eventually this placenta comes out and Savannah looks at me and goes, it's 58 minutes. It took 58 minutes to get the placenta out. She's like, 2 more minutes and you'd be hopping in my car and we'd be going to the hospital
Oh,
to get help getting the placenta out. And I'm like,
yeah.
again, they were just they weren't like necessarily like hiding anything from me. They were kept coaching me
Hmm.
and making the appropriate suggestions and keeping an eye on the time, which is what they needed to do. I think if they had been letting me know we have this much time, I don't think that would have helped.
Right.
I think that would have been stressful. But yeah, so birth the placenta and then they helped me take a shower. They cleaned everything up from the birth. You wouldn't even have known, but by the time they left that we had given birth on our bed. They had changed the sheets. Rachel was making sure I was hydrating, and she had let my mom know that it was time for my mom to cook the postpartum meal that I had wanted. And yeah, so we were, and then Savannah and Aushie did an vaginal exam postpartum
Hmm.
to see if there was any injury or tearing. And I did have, I think it was in between a first and second degree tear, but it was really minor. And they asked if I wanted sutures or not. And so at that point, I asked as many questions as I could think of at that time to make that decision. Savannah gave me, this is what would happen if we did it. This is what would happen if we didn't. But they left the decision up to me.
Hmm.
And then I made that decision of not getting stitches and yeah, just continued to rest. And they left us feeling very cozy and comfortable in bed with our baby.
That's wonderful. I have
Yeah.
seen that, because a first to second degree tear is really common for first time moms.
Mhm.
And in a lot of hospital settings and births that I've attended with midwives, that kind of like we could stitch, but you
Mhm.
could heal, and leaving it up to the mom.
Right.
I've seen that happening more and
Yeah.
more, which is a really, really beautiful thing because, you know, it's your area.
Fun. Yeah. And then the next morning, I will say I felt a lot of
Birdie.
doubt
Oh,
about the decision, which at that point, it's a little late. So Savannah can't do anything at that point. I
yeah.
would have to like go into a hospital, right? To like, if I wanted that. But this is where like a doula is so important for me to have. And I called Rachel and I was telling her everything that happened or how I was feeling about the decision I had made. And I'm like, I don't know if I made a mistake or whatever. And I think just talking it through with somebody who has an objective perspective, who has no agenda or anything for you other than your well-being and your health and happiness mentally, emotionally, and physically was so important. And so just like talking with her for a few minutes about it, and I hung up feeling like I had made the right decision. And I think that's just so important to have that kind of support. Yeah, to be able to lean on somebody else for that and like not my husband who's a new dad or like my mom who can't really this has been a long time for her. She doesn't really have any experience in this area, right? So
Yeah.
I think that was really, really helpful for me to have.
That's fantastic. So
Yeah.
it's now the three of you. You said your
Yeah.
mom prepared an immediate kind of postpartum recovery meal. You also
Mhm.
indicated earlier that they're immigrants, so you're first
Yes.
generation. What
Yes.
cultural traditional practices were important to you and your family to incorporate into the Annika's birth and your postpartum experience?
Yeah, that's a great question. So, parents, yes, they immigrated here from India. And for us, it was really important postpartum to incorporate certain practices that were that are traditionally seen as like healing for mother and baby postpartum. So in terms of like nourishment, that's my mom cooking homemade, warm, grounding meals that were high in nutrients and that would help with milk supply as well. So there's a lot of like traditional foods that she would prepare, a lot of healthy fats like with ghee, a lot of nuts, a lot of like khichdi was my first postpartum meal, really easy to digest because when baby and placenta are gone from your belly, that's a lot of air and space. And so, which is a lot of vata energy. And so we want to, again, give your inside something that's more warming and grounding to help close and seal that space back up. And then also in Hindu culture, there are about 16 sanskars or these sort of rites of passages that mark significant stages in a person's life. And these are from the time of conception to death. And so these are considered important stages for your own purification and spiritual development as a soul. And so there are some prenatal sanskars that we do and follow starting from again like the time of conception all the way until birth. And so postpartum, we had certain scriptures that we had pre-recorded that you would typically say or sing, and we had those verses that were pre-recorded playing in the background as she came out. And there were these different rituals that welcome the newborn. There's rituals for naming the new baby. There's rituals for, feeding the child for the first time. And so these are all really special things that we have been able to continue doing as she grows.
Wow, that's amazing and so special
Yeah,
that your mom was there to kind of pass that wisdom and those traditions down to you and share them with you. And so,
it was.
what did the rest of your postpartum visit look like? Because many people who are in the hospital system, they take a 24-hour up to 3 or 4 days, depending on the mode of
Yeah.
birth. And there's lots of
Yeah.
checking in by nurses and doctors and
Yeah.
different providers. So, how in this setting for you? I know you have nothing to compare it to,
Oh,
but tell us what you
yeah.
experienced.
So for us, within Savannah left us at some point early in the morning, and within 24 hours, she came back to the house for her first postpartum visit to check on me, to check on baby. And then she made another visit, I think 3 days later, another visit a week later, 2 weeks later, 4 weeks and 6 weeks later, if I remember correctly. But yeah, so all of her postpartum visits, she came back to the house, checked on me, checked on baby. I was able to text her, call her anytime I felt like I had a question or needed anything. Yeah, those visits were all done by the comfort of her own home, and I should say bed and room because I stayed in my room for quite a bit during the first like I think 2 weeks. We also had a lactation consultant come to the house to help with breastfeeding. And she came again, did the visit in our bedroom. We found a pediatrician who also came for the first 2 months and did visits with baby by our bedside. And so I think that was really mind boggling for my parents to see all of these people coming over to the house and taking care of us and baby. And we didn't have to fuss about getting in the car, getting outside. The weather changed in March as it does in Michigan. So it was like snowing, it was cold and, at times. And so just not having to worry about even leaving when I didn't feel even, I had trouble walking to like the bathroom after giving birth. I had trouble holding Annika while I was standing up. I really had to hold her like seated for the first couple of, days. And so, yeah, just being in the comfort of our own home, that was really incredible to see that we had, I guess, sought out the support that we needed and never knew would have been possible without all the experiences that led us there.
Yeah, so I'm particularly curious. So, if you'll share the name of your lactation consultant and the pediatrician, as well as everybody
Yeah,
else, I'll put them in the show notes so other people can
absolutely.
find them and see if they're a good
Mhm.
fit for the care that they want. But I'm especially curious about the pediatrician care because
Yeah.
I don't think that most parents realize that there are pediatricians who, or even any doctors who do house calls. And
Mhm.
did you find were you planning on using that same pediatrician while you were on the track of going with the certified nurse midwife in a hospital facility, or did that come? I'm very curious
Yeah.
about how you discovered that
Yeah.
pediatrician.
No, that's a great question. I had reached out to Elise because we had been looking for a pediatrician, and Michigan is one of the few states that allows for vaccine choice.
Mhm.
And so that means you can give all of the vaccines. You can give none of the vaccines. You can choose to give some of the vaccines. You can choose to delay the vaccines. There's so many options. And for us, we wanted a pediatrician who was willing and able to have the conversations with us and allow us to make the choices we wanted to make for our baby. So most pediatricians are tied to the health system and they're bound to the reimbursements through insurance companies and they're kind of like forced into you can either follow our protocol and abide by giving everything that we recommend or we can't take you as a patient.
Mhm.
And so but there are providers out there who work outside of a traditional medical model, and it's more like a look like a concierge style practice where you pay a monthly fee, and with that monthly fee, you're allowed as many visits as you need and want for your baby. You're allowed to communicate with them as frequently. Like I can text her pediatrician, I can call him whenever we need something. I can go for as many visits as we need, and with that is the understanding that, you know, he's working together with us and supporting us as new parents in the decisions that we want to make for our baby. He's not pushing us in any particular direction. And Tom and I, we both come from a pharmacy background. So for us, it's important to have conversations and be able to challenge, what we're told or seek out more sources of information, some studies, things like that. And he has been able to provide all of that and more for us. And so that was, I think, important. That was a big priority for us is not just who's going to be by our side during pregnancy and postpartum, but who's going to be by her side, as she continues to grow and help us make the best decisions that we can for her.
Yeah, wow, that's
Yeah.
really fascinating. Does he work in a team or is he an individual provider?
He's an individual provider, Dr. Alexander Odell of Origin Pediatrics. Yeah, he works out of West Bloomfield. And yeah, just a blessing in disguise,
Yeah.
really. Yeah, we're still really much enjoying working with him.
Yeah, that's fantastic. And so from start to
Yeah.
finish, it sounds like you and Tom were really committed not to a specific plan or way, but to just
Mhm.
gathering as much information as you can and flexing and changing if it felt necessary for you.
Mhm. Yeah, I would agree with that. I think the biggest thing for us was as soon as we got pregnant, we realized that whatever decisions we were making moving forward were affecting another life and they weren't just about us anymore. Even though baby wasn't even there yet, I think we just really felt the weight of the responsibility on our shoulders and we had so many conversations and we're on the same page about being as intentional as possible with every decision that we were making. And that included every person on our care team or what our birth plan was or what we both felt comfortable with or uncomfortable with or talking out our fears, our anxieties, all of that. Every step along the way, we just made sure that our baby came first. And that was, I think we just were very intentional. And I don't feel like I've been intentional about anything as much as I have during pregnancy and into postpartum and becoming a mom. It's been a journey. It's not been easy, but yeah, I think it this experience has showed me what is possible
Mhm.
for you. And I think that's the biggest message that I want to share with women who are planning to start families or who are planning to continue growing their families is that it is possible to have the support that you need to work towards your vision of what you want your birth to experience to be like. I mean, I could say that with confidence that if things had gone differently and for whatever reason I ended up not being able to give birth at home and this situation changed and I had to transfer or something like that, I could confidently say that I had really done everything in my power, in our power, not just as with me and Tom, but as a care team to work towards that goal.
Mhm.
And then ultimately, at some point, you do have to let go. But we really wanted to give it all that we had to work towards a goal. And sometimes I hear from, I teach prenatal yoga, and sometimes I hear from women saying that they don't really have a birth plan and they're just going to let whatever is meant to happen happen. And then I also feel like you're inviting that energy into your experience though.
Mhm.
You're inviting whatever to happen and having some sort of intention or some sort of vision, not just be attached to it by any means, but to just give sense of energy in that direction. And you never know what doors will open up for you when you have focus and a goal and a direction or who what people you might cross paths with. And so that was big for us, staying open and staying curious.
Yeah, yeah. That's
Yeah.
a really good point. Um, so you're teaching prenatal yoga, and so I have to
Mhm.
bring up kind of the elephant in the room because it sounds like you and Tom, you have the financial resources because none of this is covered by traditional health insurance, correct?
Mhm.
Yeah.
That's correct.
So it sounds like you guys
Yeah.
have the financial resources to kind of put your vision into reality. What would your
Hmm.
advice be to one of your students who says, wow, Trishna, this is great. And I would love to be able to do this for myself and for my baby, but I don't have the same financial resources that you had. What can I do to kind of mitigate that
Hmm.
medicalization or the infringement of my vision into the circumstances that I
Yeah.
have being in a hospital system?
Yeah. That's a great question. It's unfortunate that so much of the holistic care is outside of things that are covered through insurance. I would say keep doing research and keep connecting with people and asking questions. I would even say reach out to different midwives or care providers that you're interested in and have a conversation with them because whether or not you can work with them with your financial situation it could be an option or they might be able to direct you towards a trusted referral or resource that would be more financially manageable for your family and for your vision, or there's some birthing centers in the area. Like, I don't know financially how that is structured, but I think exploring your options and not being afraid to ask questions because again, that way you can gather all of the information to be able to make a decision rather than assuming. I think a lot of the times we just assume that it's like a blanket statement. If it's true, if she had to pay out of pocket and it was then that's the case for everything and everybody. But you just never know like how different care providers work in this community. I would also say so continue to be open, continue to have conversations if you're curious. And then you could also see if you could work parallel, right, with like one care provider within a health system to get certain things covered under insurance, like lab, imaging, testing, things like that, and continue to see a care provider outside of the system to so that you're working alongside each other, but some of those miscellaneous costs are covered through your insurance.
Yeah, those are great suggestions. And I think, like you said, there are providers outside of the system who maybe will practice that I've heard of, do like a sliding scale based on your
Hmm.
income level, or you
Yeah.
might even have, I know that there's a doula
Like a
group.
payment
Yeah,
plan.
the payment plans. There's a doula group who
Mhm.
allows or encourages some of their clients who can't afford their full range and cost of services to donate or ask to have a certain portion of that donated to people who can't. So there are some really creative ways that we as
Okay.
providers could help fill those gaps. But I think that you have really mentioned some good things about the parallel care and having some of those things that are naturally covered by insurance still covered. So those are great suggestions. I really appreciate that. How's
Yeah.
Annika today? How's Tom? How are your parents? They sound like such a big part
Oh
of
my
your
goodness.
story.
They are. They're a huge part of my story. Everyone is doing well. Annika is almost 17 months. She's running. I want to say walking, but she's running around. She's almost starting to speak a little bit, which is really exciting. And she's finding her voice. She's curious. She's fun. She's got a little spicy personality, which we love. But she's coming more and more into her own. And it's just been a joy watching her grow and explore the world through her eyes. It's been, yeah, been beautiful.
That's fantastic. And your parents, are they hankering for
Yeah.
more grandchildren or?
Oh my goodness, always, I mean. But they're definitely soaking up all their time with Annika. She's the first girl in my family and the first grandchild on Tom's side of the family. So yeah, everyone is soaking her up.
Fantastic. That's great to hear.
Yeah.
Have you continued having relationships with Rachel, Savannah, and the birth assistant? I can't
Oh
pronounce her
yeah.
name.
Yeah, Aushi.
Aushi.
Yeah. Aushi, yeah. I definitely stay in touch with Rachel and with Savannah. I've been, especially with teaching prenatal yoga and sometimes reaching out for certain questions students might have or recommendations or referrals. And so, yeah, we're definitely still in touch. And of course, with her pediatrician, kept in touch with my lactation consultant up until I stopped breastfeeding, which was, I think 15 months. And so, just, yeah, having those ongoing relationships has been really nice and refreshing. So,
That's great. That's fantastic to hear.
yeah.
Trishna, I think
And
your story does show what's possible. I think that you've opened my eyes up to some things that even I, as a veteran birth worker in Metro Detroit, was not aware of, such as your pediatrician. And so I thank you for that. And I'm sure that people who hear your story through this podcast will also take away some very valuable little nuggets of information. So thank you for being so open and sharing such a special story with us.
I really appreciate you having me and giving me the opportunity to share it. And like I said, the biggest message I want to share is for people to just be open and curious and don't settle for what doesn't feel right. Yeah. Keep looking.
I think that's a great note for us to end on. So thank you so much, Trishna.
Thank you.
Thank you for spending time with me today on Metro Detroit Birth Stories. If you loved this episode, let me know. Leave a review, share it with a friend, and come connect with me on Instagram at Metro Detroit Birth Support. And if you have a birth story to share, I would love to hear it. Please take a moment to reach out to me, whether it was 6 months ago or 60 years ago. Your story could be the inspiration for someone who hears it to gain the confidence they need as they embark on their own birth journey. My email is in the show notes. This podcast is produced and funded by me, and I really appreciate you listening. Until next time, take care, be gentle with yourself, be kind to others, and remember, every birth story deserves to be told. The music you hear on Metro Detroit Birth Stories has been provided by Purple Planet Music, written and performed by Chris Martin and Jeff Harvey.